Goeienaand, good evening, fellow South Africans and citizens of the world. And the hospital system in South Africa just goes from worse to worse to worse. I don't know how much worse it can get, but apparently it can. Consider this situation. Medical experts and health workers were outraged after learning that patients' stillborn babies were allegedly left at the foot of their beds at Wentworth Hospital recently, in contravention of the Human Tissue Act. Teresa Anderson, 55, said she was left traumatized 2 weeks ago after an already unpleasant visit to the hospital's labor ward. She was visiting her daughter, Carrie Wilson, 32, who lost her baby after a road rage incident. During afternoon and evening visiting hours, Anderson noticed red buckets at the foot of the beds of two women who had given birth to stillborn babies. Anderson said, "I asked the nurses what was in the buckets. They said to me, 'In those buckets are babies.'" Yeah, you heard me right. She was horrified. She asked, "Can you leave a dead fetus at the end of the patient's bed and for so many hours?" She said her daughter was discharged quickly, which she believed was because she had questioned the nurses and taken photographs of the buckets. She said, "This is not acceptable. These people have gone through the trauma of delivering dead babies, and now you want them to go through the trauma of looking at these buckets for over 5 hours. Medical law consultant Dr. Shadfruddin Ahmad said that the alleged practice contravened health legislation and good ethical practice. Ahmad said, "From a legal and ethical perspective, it is in contravention of the Human Tissues Act, and charges and complaints should be lodged with the relevant statutory bodies." He said healthcare practitioners had not shown compassion and should be held accountable. He said the mothers were at the added risk of severe post-traumatic stress disorder. He went on to say the Department of Health should answer to this, and they need to provide the mothers with immediate psychological interventions. Now, I just have to say quite cynically, I'm amazed that these fetuses aren't being rushed off to the local Sangoma or witch doctor for muti. You know, this is what would probably happen back pre-1652. You know, but the treatment of these poor mothers and you know the disrespect to these fetuses is just disgusting. Claire Brower, a mother of 8 who is training to become a doula, said she was horrified that mothers had been left with their stillborn babies placed in buckets. She said, "Post-traumatic stress is going to stay with these mums and others who witness it. There is a lack of compassion and empathy and basic decency." Brower said losing a child was a painful experience and a mother should be surrounded by love and compassion. She went on to say, "The last memory she had of that baby will be the most disturbing one. She should be able to hold her baby and say goodbye, and the remains of her baby should be handled with respect and dignity. This is a basic human right. Her chances of experiencing postpartum depression after an experience like this are greatly increased." A state nurse who spoke on condition of anonymity identified the buckets as those used to store human tissues, such as amputated limbs and stillborns. The person said it doesn't stay with the patients. It has a proper area. It should be taken to the mortuary because it could smell, unless it is in formalin, a preservative. It is going to the lab to be tested. DA spokesperson on health, Dr. Rishigan Varana, said it was a disgraceful situation and called for an investigation. Varana said, "It is a complete violation of their dignity and the emotional damage is severe. Every patient deserves support and dignity." He added that the Human Tissue Act was clear and regarding how human tissues should be handled, and he agreed with Ahmad that the storage of stillborn babies in buckets at the foot of the bed was in contravention of the Act. Democratic Nursing Organisation of South Africa Provincial Secretary Mandla Shabangu said shop stewards were unaware of the incident. Of course they were. No one's going to admit to it, are they? KwaZulu-Natal Health Department spokesperson Nolotando Nkosi said hospital management had no knowledge of the allegations until they were raised by the paper. However, she said the allegations were concerning and the department was looking into the incident. Yeah, another turnaround strategy. Go figure. And Nkosi said all healthcare workers are trained in and have a responsibility to follow standard operating procedures at all times for the disposal of medical waste. This ensures that this process unfolds in a quick, respectful and dignified manner and with minimum trauma or discomfort to the mother and or any other healthcare users, and is done in keeping with established infection prevention and control protocols. She urged the public to immediately report any instances of the improper disposal of medical waste to hospital management. Now, it's just getting more and more crazy. The public health system or the public hospitals in South Africa are death traps. That's all they are. And the level of care supplied by a growing number of nurses, I'm not saying all nurses, but by a growing number of nurses in South Africa, is just destroying the reputation of all the nursing staff in South Africa. That's the sad reality. All right, guys, please remember to subscribe to be kept informed. Ring the bell for the updates. Please like this video. Please share this video. And above all, stay safe. Bye for now.